Hello everyone. So as part of the palliative care, end-of-life care quality improvement project that we're doing at the moment, we thought we'd like to just show you one of the tools that are available to you on Unity. And that's a tool called the SPICT assessment. And the SPICT assessment is a validated tool that can help you identify patients who may require a palliative approach to their medical care. And it asks you a couple of questions that might prompt you to consider whether that's the case. So we've got a test patient here on the screen, and this is how you find the SPICT tool. You go to the ad hoc button in the top bar, and then if you go to assessments, the fourth option down, at the very bottom you've got the supportive and palliative care indicators tool, which is shortened to SPICT. So I'll press on that, go to record. And then what you see is a whole range of questions. It doesn't take long to do, but it will just prompt you to think through whether, for example, your patient has had any unplanned hospital admissions. So we'll say yes to that. Whether their performance status is deteriorating. And again, we're going to click yes on that and ask you a few other questions. And we're also going to say, yes, our patient has got persistent symptoms despite optimal treatment, which might, in fact, cause you to think perhaps a specialist palliative care referral will be useful for this patient. And then if you go down further, you can look at a number of different questions which will be relevant to particular medical conditions that your patient may or may not have. So for this particular patient, we're going to say they've not got cancer or heart disease. We're going to go for respiratory disease. And yes, this patient that we're imagining has got a severe chronic lung disease with breathlessness at rest and persistent hypoxia, and has needed ventilation for respiratory failure. And now the decision has been made that we shouldn't be doing that again because that wouldn't be the right thing to do for this patient. So I'm going to click on those things. And if I keep going down, there is a risk that this patient might die with the condition that we've identified for their respiratory condition, and perhaps they've got some other comorbidities as well. And so the outcome could be poor. So I'm going to click on that. So this then leads me to think through what might be the implications of going through this SPICT tool. And I might want to review the current treatments and the medications to ensure that the person is receiving optimized care and that we're cutting out any unnecessary drugs. I might want to consider referring to the palliative care team for some specialist assessment and input, and then agree both the current and future care plan with the person and their family. What are their priorities? Where do they want to be looked after? And how do we achieve those goals all together? Plan ahead about what might happen if the patient loses their capacity. It also asked me, do you want to start recording this in a coordinated care plan manner, such as the supportive care plan? And in this occasion, I'm going to say, yes, that does seem appropriate, because I would not be surprised if this patient were to die in the next 12 months. And then it takes you to the supportive care plan, and you can fill that in as per you usually do, looking at all the different questions which are relevant to someone on the supportive care plan, such as their anticipated prognosis, etc. I won't go through all of that. So that's just a whistle-stop tour through how to complete the SPICT tool on Unity. And I hope that you find that a useful resource to be using as you consider which patients might require a more palliative approach to their medical care. Thanks for listening.